I'm a cardiac nurse anesthetist at a very large academic center, the largest transplant center in the world. Well, it was in the middle of COVID. There was a lot of diagnostic issues because chest x-ray wasn't necessarily very conclusive. As well, ultrasound and point-of-care ultrasound is so convenient. It's like having a stethoscope with you. And the CT imaging is very bulky, time-consuming, an hour away. So Intelligent Ultrasound came out with a very nice module on COVID with pleural thickening, consolidation, and eventually B-lines, and was actually contemporaneously based on the progression of the disease, such that we decided to get out a very nice working portion on COVID diagnostics and the use of point-of-care ultrasound. We put it through eLearn as well. We went through several academic hospitals' Spark Learn and on-site learning programs. Well, you know, it's point-of-care ultrasound's the evolution. It's the new stethoscope. It's what advanced practice nurses and CRNAs like myself are all doing. It's something that ER physicians have been doing for 30 years. And it's one of those things where just a simple, quick look can tell you more information than a 10-minute history and physical, and certainly faster than a trip to the CT imaging lab. As well, while it's not as robust as regular ultrasound and sonography, it gives you the yes-no answer to the question. We like to take our students and our CRNAs and give them some online learning as preparation, and then when they come in, I thought they were actually cheating on the exam because the scores were so high, but it must have been a pretty concise module, and when they came in and used a simulator, it improved their ability to scan, you know, tilting, rocking, sliding, much more so than any type of YouTube. And I think if you can compete with YouTube or Vimeo or any of the other online modules, you're really doing well. Absolutely. The students really embrace PoCUS. They embrace ultrasound, especially because it's the coming thing. I think in January of this year, Council on Accreditation met and decided that we're going to incorporate it into the curriculum starting 2022, and we're already ahead of the game. As well, next month I meet with in a webinar with the ANA where we're going to incorporate PoCUS into a lot of the education pieces coming out in the CPC. They've been supportive of me since 2015. I was the first CRNA teaching ultrasound and echo, and we went to Florida, and it was very awkward because non-physician in a physician realm, a physician area of expertise that was teaching to nurse anesthetists. And truth of the matter is, it's not about it's a turf war. It's a matter of access to care for a lot of people that are in rural areas, more rural areas. So that's kind of where we started. Intelligent Ultrasound supported me the entire way. They've supported this program, and it's been a very good relationship. Well, I see 100,000 advanced practice nurses and nurse anesthetists that are needing to pick up a skill set that's going to improve their ability to provide patient care, and I see Intelligent Ultrasound and myself as not pioneering the way, but, you know, facilitating it.